Good morning. This is Luca Corso, and I'm the medical focal point for IOM Italy. As IOM's office in Italy, we thought it was important to make this short video in order to give you some simple information about the new coronavirus, along with some suggestions on how to prevent infection. Coronaviruses are a large family of viruses capable of causing diseases in humans and animals. In humans specifically, they can cause illness ranging from the common cold to more serious diseases. Covid-19 is the name of the new disease caused by the coronavirus. Co stands for corona, V for viruses, and D for disease. The number 19 is the year in which the disease was first identified. But the virus and the disease were in fact unknown before December 2019, when the disease first emerged in Wuhan, China. Most frequently, the symptoms that COVID-19 cause are fever, excessive tiredness, and dry cough. More severe cases can also lead to pneumonia, severe acute respiratory syndrome, and even death. The effects of COVID-19 on the human organism are currently being studied. However, it has been observed that some sections of the population are more vulnerable. For example, the elderly or those with pre-existing conditions, such as high blood pressure, certain heart or lung disease, diabetes, and cancer. All of these factors can increase the likelihood of complications. To date, there's no vaccine, and there are no specific antiviral drugs for COVID-19. People with the symptoms can be treated for those specific symptoms, and in serious cases may be hospitalized. But in most cases, people can recover after adequate treatment. In order to prevent infection and avoid spreading the virus, there are some simple but very important rules to follow. First of all, frequent hand washing. During the day, wash your hands with soap and water. When soap and water are not available, then use an alcohol-based solution. Second important indication, always keep a distance of at least 1 meter from other people. This is important because the virus is contained in the breath's droplets, and a close proximity to others heightens the risk of transmission, especially in cases of coughing or sneezing. Another very important indication, avoid touching your mouth, nose, and eyes with your hands. Our hands come into contact with various surfaces throughout the day and may thus be contaminated. As such, subsequent contact with the mucous membranes of the face can increase the likelihood of infection by the virus. Another important indication, maintain good respiratory hygiene. Whenever you need to cough or sneeze, always cover your mouth and nose with the crease of your elbow. If you use disposable paper tissues, throw them away immediately after use and wash your hands once again. Another important indication, avoid shaking hands and hugs for the same reasons we mentioned earlier. Last indication, respect social distancing measures and stay at home, especially in the case of symptoms such as fever, dry cough, excessive tiredness. In case you're experiencing these symptoms, contact your doctor of reference who will provide you with all the indications necessary to manage your specific situation. Thank you for your attention. I hope this information can be of help in managing the current situation so that we may overcome this period together as soon as possible.